Assistance Center. We're partnered with NIAPRIS today, and we are having our kickoff webinar and informational webinar around the Adult Engagement Dissemination Learning Community. My name is Cara Dina Sale. I'm a social worker, and I'm here with the CTAC crew. I'm with Lydia Franco, Jason Jones. I'm going to let everybody just say hello and just say a word about themselves, and then we'll begin.
Hi everybody, I'm Lydia Franco. I'm a social worker. I'm part of the Community Technical Assistance Center as one of the co-leaders of the clinical initiatives alongside with Cara, as well as some of the work that we're doing out of the McSilver Institute for Poverty Policy and Research. We've also, both Cara and I, if I can say, we've also done quite a bit of work around engagement specific to children and families, and we're very excited to be able to expand it now to adult services.
Hi everyone, good afternoon. My name is Jason Jones. I am a recent member of the CTAC team as well as McSilver. I'm also a social worker, and I'm very excited to start working with you around engagement.
Great. Then we also have Dr. Salerno with us.
Hi everyone. Many of you out there in adult services may know me. I was involved with the Office of Mental Health for like 30 years or so, retired a number of years ago. But I was very involved in the wellness self-management, if any of you were involved in that particular project. And this area of engagement, I'm very excited to get to be part of this and to support your efforts, because it really comes down to a very critical need so that folks are able to receive the services that will benefit them. So I'll be part of this learning community. I'm looking forward to working with all of you.
Thank you. And we're also joined by NIAPRIS, our partner in this collaborative. Ruth, would you like to say a word?
Yeah, thank you, Cara. Good afternoon, everyone. My name is Ruth Coulombe-Wagner, and I'm also a social worker, and I serve as the Senior Project Coordinator with NIAPRIS, and that stands for the New York Association for Psychiatric Rehabilitation Services. We are a statewide coalition of people who use and or provide recovery-oriented community-based mental health services. NIAPRIS is dedicated to improving services and social conditions for people with psychiatric disabilities, and those with trauma-related conditions by promoting their recovery, rehabilitation, and their rights so that all people can participate freely in our community. I want to say that NIAPRIS is very, very proud to be working alongside the McSilver Institute on the CTAC project. We know how important the work that you do is, and we want to be able to support you as you work with your participants to help them achieve wellness. You will notice that I use the word participants. We've decided that as part of this project, we're going to use more recovery-oriented language, and so you won't find us saying client or consumer or definitely not patients. And so we want you to know that we're going to be using the word participants. All right. Thank you, Cara.
Thank you, Ruth, and thank you to all of the presenters today and for CTAC, and thank you all for participating with us. I'm going to show you what we're going to do today. Here's our agenda. Welcome. We're going to talk about the importance of client or participant engagement and the supervisor's role. What is this learning community that we're talking about, the Adult Engagement Dissemination Learning Community? Why are learning communities important? Why is this learning community important? And how to join. Then we'll go over some activities and time frame. And then we'll have a little time for question and answers at the end if you have any. But I want to draw your attention to the panel on the side to the right. If you haven't participated in a webinar, this is our kind of control panel, and you can chat to us questions in the chat box at any time throughout today's webinar. We are going to have about 2 or 3 polling questions. The poll will pop up, and we really invite you to participate, and you will have some options to click A, B, C, or D, and then you would submit your poll. So welcome. We're so excited to have you. Welcome to this Adult Engagement Dissemination Learning Community. I know it's a mouthful, but it's really important because we are focusing on adult engagement practices with you throughout our time together. And we're partners in this really important effort. So this isn't something that we're doing to you, this is something we're doing with you. And so we're going to be spending the next several months with you. We're going to be together until June, really focusing on engagement practices, enhancing those engagement practices, and really getting feedback from you as well as to what works and what doesn't, as well as providing you with several educational experiences. You're really contributing to our collective knowledge focused on engagement practices to help increase attendance and participation. So here's a polling question. It will pop up. Which of the following engagement-related topics can be improved at your clinic? Would you say high rates of initial appointment attendance could be improved? Would you say adherence to follow-up appointments could be improved? Or current client engagement practices could be improved? Sorry, it looks like that's double there. Or we are satisfied with our current engagement practices. Which would you say, A, B, C, D, or E? And C and D are the same, so I apologize for that. So A, B, C, D, or E?
I think, Kara, I think D refers to policies, yes, and C refers to practices.
Thank you so much. Lydia just pointed that out to me. Sorry, everyone. So one is practices and one is policies. A, B, C, D, or E? So the poll is up and it will close, and Amanda, you can bring up the results when you get a chance.
So sometimes there's a little bit of a delay. It'll pop up shortly. There we go.
Great. Thank you, everyone. So it looks like it was sort of neck and neck around adherence to follow-up appointments and current client engagement practices and not policies. So it looks like we're neck and neck around B and C. So thank you for participating. We just want to get a sense of why you're here and what you think can be improved in the work that you're doing as we start off this initiative together.
So we wanted to kind of start off by highlighting some key ideas around client engagement and the importance of client engagement. And I think everybody on the phone or on our webinar really, doesn't need to, I think everybody understands the importance of engaging clients in care. And I think the important thing here is that if we can engage clients or participants, I'm sorry, we're trying to change some of that language as well. Thank you to Ruth. If we can start thinking about our participants, the people that come into our clinics, and really start thinking through how can we help support them, how can we engage them in the services and provide them with the types of treatment and assistance that they need. And I think everybody here probably knows that in order to really evidence really good outcomes, we know that the primary vehicle through that really kind of helps support, achieve some of those, important outcomes is really that participant-therapist relationship. It's that working or helping relationship that is developed with the participant from day one, from that very first initial contact. And I think one thing that we're going to challenge you to really thinking about as you participate in this learning community is to think through what does that first contact look like. And maybe that's the person at the front desk, maybe that's just the appointment scheduler or an intake person, or maybe that's a clinician, but really thinking through what does that initial contact look like, because it really begins to set the tone for developing that therapeutic relationship. And I think what we're going to be working with you on in this learning community is really thinking through some of the same things that you highlighted in the poll, which was how can we help decrease some of those no-show rates, how can we help support people in participating in services and really retain them for the time that is needed to evidence some of those more positive outcomes. But I think in a lot of the work, so CTAC, we've been doing, now implementation of a variety of different practices and models and working with a variety of different clinics across the state now for about 3 or 4 years. And I think in this time, what we've really come to realize is the importance of the role of the supervisor in all of this work, that we can really kind of give information, provide trainings to frontline staff, we can give suggestions and tools, but the role of the supervisor really is vital in making sure that new practices are implemented appropriately and that there's follow-through and a consistency and a sustainability in those practices as well. So the role of the supervisor is really vital in this learning community as well, and this is why we're going to really focus on working with you and the supervisors to really kind of think through what will work in your agencies, what can we do differently, how can we apply some of the engagement strategies that you'll learn through our learning community and through our trainings, be able to provide those trainings for the frontline staff, but really work closely with you in supporting you in implementing some of these strategies. Your participation is really, truly integral in this adult engagement dissemination process. So I think, Tony, you were going to talk a little bit about the learning community in a little bit more depth.
Yeah, thanks so much, Lydia. You know, and the point I think, Lydia, you were making is engagement is not separate from treatment. It's the core of treatment because there really isn't positive outcomes unless the person we're working with is fully engaged in the work. It can't be something done to them. So establishing that partnership, meeting expectations, the alignment of expectations, and many other things go into it. So we are choosing this learning community type of approach, you know, rather than just, you know, sort of giving out here are the best practices on engagement. But what's really critical is that there isn't a single right answer to any of this. So that the purpose really of a learning community is to begin to introduce folks to some of those skills and resources to build competencies in this whole area of engagement. And as Lydia mentioned, the supervisors really can function as the bridge between the acquisition of some knowledge, but true learning involves the application of that knowledge and working with their supervisees, the teams, in real time with real clients in real situations. And then the learning community is where we all come together to problem solve collectively. There's huge amount of expertise out there, and we do not see ourselves as, gee, we are the experts, just do what we ought to do what we say is important to do. We don't approach that in that way at all. And for those of you who've been involved in any CTAC approaches, you know, our guiding principle is partnerships with others and really wanting to build and create an opportunity for people with knowledge, expertise out there to share that with others and to problem solve collectively. So, you know, these skills that we're going to be, you know, sharing with you, the acquisition of some knowledge and ideas, it's going to benefit, we believe, both the clinic staff, the participants, and supervisors. We hope very much, because that's a really tough role. I've been a supervisor in many different adult programs, and that is really a very challenging role. And my job was to support the people I supervised in their professional development, in their increased learning, and their confidence in being able to accomplish goals so that they find the work really meaningful and that the outcomes are really positive. So we hope that this whole process is going to lead to increase in appointment. If people don't show up, they can't benefit, and that really is what it comes down to. Now, some organizations use organizational policies and approaches that include, you know, open access types of systems or just-in-time types of approaches. But here we're going to be focusing in on that critical role of the clinician. And whoever the helper is both an initial engagement, but then ongoing engagement throughout the whole process. And so that's what we hope to accomplish with the learning community. We also want it to be a lot of fun for everyone, that it's not a pressure type of situation. We're not going to be on your backs about, you know, having to do this, that, or the other thing. You're colleagues of ours. We're professionals. We work together. We create opportunities for learning and to increase the work, the importance and the value of the work that we do. Next slide. So we're going to address the challenges and the barriers because Lord knows we have them. If there's any area that I hear and have heard for the last 35 years of my work in this area in the field of mental health is that challenge around engagement of individuals so that the practitioner and the participant are really working closely together in achieving outcomes that are aligned with the felt need of persons. The supervising clinicians provided with training and participating in a learning collaborative with an emphasis with the supervisors to really support them in their really critical role in going from acquisition of information and knowledge to the actual application in clinic settings. Next slide. So why is it important? Well, I don't think we have to make a really strong case for that. I think all of you know that this is really very important. It's going to be increasingly important in the type of healthcare system that is emerging in New York and really across the country. The whole area of managed care coming in, and one of the opportunities there that in managed care environments, this connection with clients is a really poor outcome. And so when beneficiaries in the eyes of managed care are seeking some treatment, that organization that is able to engage that individual, so that the participant's experience is, this is a place that really listens to me. This is a place where they're going to help me to accomplish some of the things that are really important to me. This is a place that I trust, where I feel safe, that I have confidence in the person who is treating me. All of these sorts of issues really come to play. And in managed care, those are going to be high priority. And as we mentioned, really the supervisors are in that challenging but also unique role, and I think can be a very, very gratifying role in support of those that you supervise, to really bring out the best, to have those skills, those competencies that build their confidence and leads to job satisfaction. And that's like the critical role, really, of achieving positive outcomes. Next slide. Okay, so I think I turned this over to someone at this point. Is it Kara or Lydia? Okay. Thank you.
Thank you. This is Ruth. Actually, I'll take it over from here. If you could just go to the next slide, please. We just want to talk about and provide you with a brief overview of our learning community. As Tony so eloquently stated, we really are a partnership with supervisors and practitioners in your organization, and we're doing this across New York State. So we will actually come to you. We'll be having regional forums and disseminate the information. Our learning community, we will be providing you with training and support to implement very specific concrete engagement strategies in your organization. We will establish an ongoing partnership, which I think is just really, really wonderful, because we're not going to just give you the information and then leave you alone. It really is going to be an opportunity for you to ask questions, give us a call during the project, and get some technical assistance for your specific needs. And we will also explore the role of supervisors and clinicians in the relationship of client engagement practices in order to enhance your current practices. Can I have the next slide, please? Thank you. You will be provided with training and coaching support, which is what I was indicating before. We're going to provide you with one half-day regional educational forum targeted specifically for supervisors. We're going to follow this up with 3 educational web-based trainings. Now, that's obviously open to supervisors, but it's open to your entire clinical team, including your office support staff, who often are the people who first take those phone calls. And we're also going to be providing 3 small group corresponding consultation phone calls. And you, as I indicated before, will have access to everyone on our resource team if you have questions or for technical assistance. Next slide. Okay, right back at you.
Thank you, Ruth. And we just wanted to also mention that we have the Regional Educational Forum that we're going to provide to you. And what this is a one-day from about 10 a.m. to 2 p.m. forum for supervisors. This is where we're going to really have an experiential day with you, talking about in-depth these engagement practices, talking about supervision, reviewing your current practices around engagement, and then we are going to have a variety of tools and resources for you. All of those are optional, and so we're going to talk with you about them, but this is what that day from 10 to 2 will be composed of, and we will have them based on our applicants. So if you're in Central New York, we're going to find a way to come to you. If you're in the Hudson region, we'll find a way to come to you. So wherever you are, we're going to have a half-day educational forum together. So we're asking all supervisors to attend that. And then we're going to be offering after that web-based trainings and consultation calls. So we're going to be offering 3 webinars where we're asking supervisors and clinicians and providers to participate in those. So participate in an hour and a half of web-based learning around initial engagement, barriers, and then we'll have small group phone calls after those 2 webinars to talk about implementation. How is it going? How are those practices? Are they helpful? Are they not? What can we do differently? What can you enhance that you're already doing well? And then we'll have another webinar on ongoing engagement and sustainability. So, and then also a small group phone call afterwards around continuing the work. So this is an outline of what we're offering. and we're really excited. I sent you a text with the link of the application. If you'd like to apply and participate with us, we're going to ask that everyone fill in an application. You can submit that to us by November 10th. We'd really appreciate that. So as a reminder, why is a learning community important? So I think Tony and Lydia really covered this, really how it builds on the collective knowledge and experiences that you all have in the settings that you work around engagement practices. There's really a lot of shared learning that happens. I've been really lucky to help with several learning communities and learning collaboratives with CTAC, and it's been wonderful to see the learning that's shared among the participants. It's also efficient and effective, so we can talk to a lot of people at one time, and you can really practice the different techniques or whatever it is that we're focused on, and you can see the results and talk to each other about that. And it's also a way for your concerns and challenges to be attended to. So we really are here as your resource team. Jason's going to talk a minute about that, to be present for you throughout the time together. I just want to talk a little bit about what the expectations are so that it's really clear for all of us. So that supervisors are really required. We're really asking you to participate. If you're signing up to participate in this half-day educational forum, we're asking for supervisors and your clinicians to really choose those practices that best fits your needs, but also to really attend our webinars, our web-based learning. So those 3 webinars I just mentioned, as well as those phone calls, that you'll participate in those. We're also going to ask you to collect and submit performance indicators. Tony's going to talk a little bit about those in a minute, that are going to help us, all of us, understand the effectiveness of the best practices. And then supervisors are also going to be encouraged to observe or partake in observations with the clinicians as they're meeting with clients or participants. Does anybody have any questions? If you do, you can chat them in the chat box to us. We'd be happy to attend to those questions and answer them. Jason's going to talk a little bit about the resource team.
Okay, thank you, Kara. So we just wanted to take a second to talk a little bit about our experiences and how we'll be supporting you throughout this process. So we will be providing all members of the learning community with technical, clinical, social, organizational, and logistical support to really help you successfully utilize these practices and learn from each other within this learning community model. So here's your resource team, and everyone here is represented on the webinar today, excluding Dr. Edie Schwartz. And we just wanted to highlight that, or at least I want to highlight, that there's decades of experience in not only learning collaboratives, but also working with these types of engagement practices through so many different domains. And I think the benefit of this type of resource team is that we're taking past and current providers as well as peers and working together throughout this process. So in terms of what we'll be doing as your resource support team, we really want to highlight a few key performance indicators that we think are integral to this process of engagement. So we really want to evaluate, how is this learning community assisting you with decreasing no-show rates? Is it helping you with the organization's client engagement practices? And are supervisors understanding and implementing the best engagement practices that are out there? And I think now Tony is going to talk a little bit about specifically these key performance indicators.
Okay. I mean, here's our effort to try to answer a question that I'm sure you want to have answered, and we certainly would like to have answered is, so how do we know that this is adding value to the good work you already do? How do we know this, helps? Does this actually, improve the engagement process, the retention process? And we use the term engagement and retention, but they're in a way synonymous with partnership building. So what would we look at? How would you know someone was to ask us that question? Now, we're not a research study. You guys are not subjects in a study. We're partnering together to make some improvements. But it's important to look at a few indicators. So one indicator, of course, would be, do clients, show up, right? So what's the show rate for like those initial, types of appointments? So one could look at it as the number of sessions that expected and completed, which is a retention, or missed appointments, which also gets at the idea of retention as well. But to really begin to ask ourselves the question, if clients are coming back according to their sort of appointment schedules, that's a strong indication that they're really connecting. Of course, people who just don't know show at all is more difficult, of course, than someone who calls because they need to cancel and reschedule and those sorts of things. But we're not trying to get super precise in all of this. You will know if you're more effective in engaging and keeping the clients connected, over time. So that's an area we'll look at. And you can track attendance and retention. You can also track if a person does sort of drop out, let's say, out of treatment, what's the reason for it? There could be a whole host of reasons. And sometimes that could be very, very helpful because you really can't improve what you don't know. So understanding why it is that folks may be dropping out may be also incredibly important information for all of you and for your organization. We want the supervisor to have some observation of up to 2 clinicians and their engagement, practices. And we're going to really talk about strategies, to do that. That's not going to be intrusive, but at the same time, the supervisor has some idea of how the clinician, and if the clinician is applying some of their new learning in, let's say, working with new admissions over the next number of months that we'll be, working together. Feedback survey to assess the usefulness and satisfaction with some of the trainings. We want to make sure that we're also providing you and addressing your felt needs. When you think about it, in some ways, this whole learning community is a parallel engagement process to the process of engaging clients. We want to make sure that you're listened to. We want to make sure that your felt need for addressing this issue and these issues are being met, that there's a way of knowing if we're moving in the right direction, which is true, I think, in engaging clients as well. So we see a lot of parallels in this process, so we'll do our very, very best so that you guys feel that you're really part of all of us collectively working, together. And then we'll have a follow-up survey. This is just basically get some feedback, from us. The big challenging one here is any opportunity for the supervisor to observe clinicians. And in some of the group work that we've done around wellness self-management, we've actually had the opportunity where the group literally had a cell phone in the middle of the group, and on the other end was us. And it could be hundreds of miles away because we were working with also some organizations in other states. And we were actually able to, sort of complete a fidelity checklist on the group facilitation skills that we listen to, over a cell phone. Of course, we want to make sure that the issues of confidentiality and those sorts of things are addressed. But we haven't got a single type of way in which a supervisor can ensure or has some information regarding how the clinician is applying some of these skills. So it could be in just having a detailed review of the session and followed by a set of specific standards where the supervisor will be, asking the clinician if they've used this type of approach, giving the clinician opportunity to do their own self-evaluation on all of this. We really want to create an atmosphere of trust and honesty so that if a practitioner is having some challenges implementing some of the ideas or suggestions we may make, we're not going to assume that somehow these suggestions were so fantastic and you ought to do it, but to have that conversation around, okay, so what might have gotten in the way? What other strategy do you consider in order to engage the client? So we'll have more discussions about that, but this will be based on our conversation so that we identify strategies that make sense in your organization and with your practitioners as well and make sense to the supervisor. Okay, next slide. Okay, so now we can just turn this over to Kara, and she'll give us some, some next steps and a schedule of the learning community timeline.
And before we do that, we did get a question I wanted to attend to. Someone asked, can this model be applied to care coordination programs such as health home care coordination? So thank you for your question. I think absolutely. I think this is a model that can be applied to a variety of settings. These are practices that everybody's probably using no matter what you're setting, and some ideas around enhancing them. So if you have participants that are attending appointments, then absolutely, I think this can be a benefit to you.
Yeah, I would say all helping relationships. If we were to identify what is a core competency for every helper across, you name the credential or the type of setting. When you're in that helping kind of like relationship, I think these core concepts, these competencies, these strategies, I think are going to be applicable, pretty much, across the board. We all know, and we have discovered, and the work of NIAPers and others, there are certain things that very well-intentioned practitioners do that can turn a client off, that can contribute to disengagement. It's not intentional. It is not, and it doesn't even on the face of it look like it would be a problem. And also there's some organizational practices and policies that kind of may interfere with the engagement process. So we want to really take a hard look at that because we think that would be that clinical piece, that relationship piece, we do believe is applicable across all settings where you have a helper who is there to assist and support an individual who has some needs. So yes, I think we'll find this helpful across the board.
Wonderful, thank you. So continue to chat in those questions if you have any. I'm going to move on and talk about our timeline together. Again, if you are able to participate, if you want to participate, I have sent the link for the application. We ask for all of you to fill out the application in your organization and submit it to us by November 10th so we can get a sense of who's participating and then begin setting up our educational forums. So that's going to be our first contact with each other. We're going to be the regional educational forums in November and December. And then in January, we're going to have our webinars. Webinar 1 will be January 12th on initial engagement. January 26th will be webinar 2 on barriers. We'll then have our small group phone call around implementation of those practices on February 9th. March 2nd will be our small group phone call number 2 to continue the discussion around implementation. March 30th, we will have webinar 3 around ongoing engagement and sustainability. And then April 13th, we're going to have our final small group phone call around continuing the work. We then want to know how's it going. So we're going to be in touch with you in June. That's why I said in the beginning we're going to be together until June of 2015. And we're going to have a survey where we're going to ask you how's it going and really check in on the sustainability of those practices. So this is our timeline.
Yeah. Tara, I just wanted to add something to that last piece, because I think one of the benefits and one of the positive aspects of a learning community when we get together to ask you, what's been working, what's not so working, is that your experience adds to our knowledge base, that you're really contributing to an expansion of our understanding of the engagement process, the relationship building process, that we then kind of add to our knowledge base. So I think that's important, that in addition to contributing to your own personal work and to the clients and the organization that you work for, but you're also contributing to our expansion of our knowledge around this very challenging and so critically important, aspects of clinical treatment. And so I just want to also, emphasize that. And so we're going to be paying a lot of very close attention to your own discoveries, the lessons that you have learned, the strategies that you've tried, the things that have been effective in your own organizations, so that we collectively really begin to compile a set of approaches and a knowledge that will be helpful now and in the future as well.
Thank you. That's very true and very helpful, Tony. So this is what our educational forums. We're still setting these up, and if you participate, I'm going to check in with you about this date in New York City. I know that's just a day before Thanksgiving, so we were thinking of getting this started as soon as possible, and that would be our first. But again, I'm going to check in with you to see if that works with your schedule. And so these are all the regions we'll come to depending on who participates. So we hope to do these half-day educational forums, again with supervisors, in November and December. We have a polling question. Jason, you want to ask them the question?
Sure. So given this brief introduction as well as our discussion thus far, we just wanted to get some feedback from all of you. So what are your initial impressions of the AED learning community? It will be A, very useful, B, somewhat useful, C, not useful at all, and D, not sure yet. So please feel free to pick an answer. It should pop up on the bottom. And we're still waiting for a few more answers before we close it out. And we're getting ready to close it out now. And ideally, we're hoping that a lot of you will find it very useful because a lot of these engagement practices should be helping providers, clinicians, and organizations really connect with their participants.
So very useful.
So it looks like 15% of you think that it will be very useful, 23% of you think that it will be somewhat useful, and a bunch of you are not sure yet. So, and I think that's understandable. I think as we go throughout this process together that a lot of things will be clarified.
And this also highlights an area that as you're looking through the application, as you're listening to this webinar, the webinar is also being recorded and will be posted on our ctacny.com website if you'd like to show it to any of your other colleagues. As you make a determination if this is something that you're really interested in, would like to participate in, also feel free to reach out to us and ask us any questions, and especially anything that you feel needs some more clarification.
But the good news is nobody said not useful.
That's very, that's absolutely great. And the other piece I think is important as part of your application process. You may be a single supervisor from an agency, but there's no restriction on the number of supervisors who may want to be engaged in this and the number of practitioners in your organization. So if you're running many different programs and you would like to include others, supervisors, please just let us know what you're thinking of. Share this recorded webinar with them as well. We, want to see this expand in any way that you think would be helpful within your own organization.
So we're going to ask one more polling question. So we're just wondering, what do you think will be the most challenging aspect about this project? Learning to use the engagement practices, collecting our missed appointments and no-shows, time pressures or multiple demands, another challenge that we may not have listed, or are you unsure? And we'll like to open it up and give you some time to answer that.
If you pick other challenge, if you wouldn't mind in the chat box to just type in what that challenge is.
Okay, you can feel free to close the poll now, and we can really talk a little bit about what are some challenges that you anticipate. So we're hoping that everyone really answers this question because it'll give us a chance to really highlight throughout this learning process what areas you see that are in the most need, what areas we can help you with. Okay, so I think that one of the biggest areas is time pressures and multiple demands, which is definitely understandable given all that you do have to do as organizations and as providers. And we think that throughout this learning collaborative, we'll be able to help you with that process as well as teach you some steps that you can utilize to better engagement practices.
We're not surprised at all that the time pressures and multiple demands is one of the biggest challenges. We are very, very respectful and very sensitive to that. And to just make sure that we do not put extra burdens on you. You're not going to be hounding you for things, that you're freely engaging in this learning community, and that you will take advantage of as much as you possibly can in light of your other, responsibilities. So we're very, very sensitive to that issue. We've tried to minimize the burden on organizations and for supervisors and practitioners, but still make it meaningful, so that the way we've had this learning community of 6 months rather than 12 months. A lot of learning communities are 9 to 12 months, so this is a briefer one. We're going to do a half day of training instead of like full day of training. We'll use webinars, small group calls. We're trying to minimize the burden, but at the same time, we want to make sure we don't minimize it so much that it tends to not have the positive effect. So we want to balance demand with, meaningfulness. So we hope we've achieved that. But you guys give us feedback on that as well. If you want to make a note in your application that certain sorts of things may be a challenge for you in terms of time, and please do that. We want to have a very open tent here, so that folks, if you feel you can gain some benefit from this, we certainly want you to be involved, and we'll be very much open to all your feedback around what would make this even more feasible for you and more effective.
Great, thank you, Tony. And I just wanted to attend to a couple questions that came in. First is about the application. So a link of the application was sent in the original announcement for this webinar, so you can check your email for that. You can also go to our homepage, ctechny.com, and you'll see a link to the application there under the Adult Engagement Dissemination Project. It's also in the chat box right now. Kara or Amanda has texted in the chat box the URL to the application. And if you still can't find it, just feel free to send us an email, and we'll make sure you get that right away. The second question was, was more about, will the learning community also focus on some specific competencies that supervisors should be trained to help supervise the engagement process? And I think that's going to be a big focus throughout this learning community. First, that educational forum in November and December is really specifically for supervisors, not frontline staff, but really specifically for sitting down with supervisors, thinking through some important areas to support implementation, coming up with an initial strategy, and we'll be providing you with a number of techniques, ideas, suggestions that you can incorporate. Also, the follow-up phone calls are also going to be for the supervisors, so that will help support the ongoing implementation. We can also help to address and problem solve any challenges that arise as you're working through this. The webinars that Kara mentioned on the specific engagement strategies are the ones that will be open to everybody, frontline staff and the supervisor. So that way we're providing the training through the webinars, but a lot of our close contact will be primarily with you, the supervisors, to help support you in this process.
Great. So I hope everyone has achieved a sense today that the learning community is a dynamic process. So this content, this process, the structure is just a starting point. So all that we've talked about in terms of knowledge and as a starting point, the experience, the needs, and the wants that you all have as members really help to shape this learning community over time. So that's really important to us, that you know this is a dynamic experience. So that is all we have for today. So if you have any questions, thank you so much for those of you that have asked questions so far. If you have any more, please feel free to, you can also raise your hand if you'd like to be unmuted. We'd love to hear from you, or if you have any questions, you can also chat them in the chat box. We have just a few minutes for questions. Again, also I want to let you know that tomorrow you receive a thank you email for participating in today's webinar. The application will also be in that email, so you can click on it that way as well if that would be helpful. Any other questions?
So feel free to submit some questions now. We also have our emails posted. You could send them directly to kara.dean@nyu.edu to address any concerns as you're looking through that application, reviewing some of the materials and information we provided you today. So feel free to reach out to us between now and the application date.
If that's it, I just want to thank you all so much for being with us today, and thank you for all of our presenters. We really look forward to seeing you in person at the educational forums, or also answering any questions or hearing from you about any questions or concerns you may have. So again, kara.dean@nyu.edu if you have any questions. You will receive a link to the application in the thank you email, or it will be on our website. We hope you have a wonderful day and take good care. Bye-bye, everyone.
Bye-bye, everyone. Looking forward to working with you. Take care.